with you this morning. It's a beautiful day, and I can speak with some degree of certainty that it is a day that, as we progress and as we are able to share in this time one with another, especially when there is a way in which it's a day that can have significant meaning for all of us. And I do pray that by the time we leave here today, we will be convinced that we did take advantage of a moment that will have meaning for us in many days to come. When I was asked to do this, I found myself thinking that I wanted to be sure that whatever I said was something that would, in one way or another, have some impact on all of us in a way that will allow us to know that this was time well spent and that this day is one that we do feel that we have a great responsibility to carry from this place and with us for some time to come. So there's no such thing as being a preacher and not having a theme, all right? So let me just tell you what the theme is. And if there's anything that ends up being less than satisfactory about it, I'll just give you the names of the persons who told me that I only had 3 minutes. The theme that I'm going to use for just a few moments is sustaining the bloodline of North Nashville. Sustaining the bloodline of North Nashville. When I first started thinking about the way in which this might be framed, I simply took the names of the institutions that I felt were most important to use in a language similar to that which I have just shared with you. But I do think that it's a way in which the intention is to make sure that there is a sense of appreciation, a sense of understanding, a sense of full awareness, a sense of that fact that for us to have in this gathering a sense of oneness that will allow us to be able to take any piece of what I might share with you and have it to be sufficient in terms of what we might want to remember about this moment. So I got up early this morning and I ended up thinking about a few people who I knew would be here, and I wanted to make sure that I did not miss the opportunity to give them some sense of what I thought might be an important consideration, and that is the importance of sustaining the bloodline of North Nashville. I would say to you that sustaining the bloodline of North Nashville is significant in my mind because over and over again I have had reason to come to this place and to be a part of many of you that are here in terms of being sure to stay focused in terms of the significance, the meaning, and what it is that we should all appreciate about the bloodline that is a part of what it means to be here in North Nashville in times like these. 2 or 3 minutes is really hard in that regard because you see, to do justice to the ways in which the institutions that we will be referencing in these moments together is something that anything that it requires of us in terms of the ways in which we might want to consider, the ways in which we might want to analyze, the ways in which we might want to make sure we get the full significance of what it means to be about the business of sustaining the bloodline of North Nashville. I want you to be clear that I worked hard starting at about 3:30 this morning to figure out how to make this fit into 3 minutes. And one of the things that I had determined would make a difference is probably just to call some names. I want you to know I ended up with I have a friend who's a preacher who loves to do this, shake the pages. But if you had seen that page, you'd realize there are 23 names on that page. 23 names that go as far back as the first woman, a woman who I remember with a great sense of joy in my heart. Her name is Mrs. Janetta Hayes. Many of you don't have any idea who Janetta Hayes is or was, but she was the first woman that was ever the head of the NAACP here in Nashville. There are others like her whose names I could call, but I think what I want to do more than anything is to suggest to you that in the midst of all of the different ways in which we could point to and identify and celebrate the persons who have been major contributors to what North Nashville has become and what we are hoping and anticipating will be the future. So let me just take a moment and suggest to you what it means. This business of sustaining the bloodline of North Nashville is important because I remember something that someone told me. Dr. Hilder, you did something that I thought. I said, was good grief, who told him that I did that? But what I did was always tell people that I came here for 2 years, 52 years ago. And as much as I was enjoying your presence around when you left before, my attitude was this could be a crisis. But instead, what it became is an appreciation for the ways in which this community is one that has a history and a tradition of being able to weave the fabric of our collective existence into something that is important to us all and for us all. And what I would say to you in that regard is this. There are many names that we could call. The last thing my wife said to me before I walked out of the door was, you don't have to call all of those names. But I did find myself appreciating that to do justice to the bloodline of North Nashville, I needed to probably call all of the names. All of the names means calling those who have taken it as their personal responsibilities to make sure there is reason to want to be in North Nashville and reason to want to understand how we should be about the business of sustaining the significance and sustaining the meaning and sustaining that which for all of us represents insight into how this community is one of vital significance. And it's that way because the foundation has been laid. There is a way in which there are those who have come, who came with the purpose and the meaning for themselves in coming this way to make sure that what happens here does not in any way end up being undermined by anything that would compromise the rich history which is at the core, at the heart, and at the center of what it means to be a part of this community. There are little things about it. There are big things about it. For my wife and I, a couple of little things, one is named Harriet, and the other is named Kazi. Little things. They were born right across the street. And their birth here is something that has meaning for us to this day. I was just sharing a little earlier with another person that's here that one of the more difficult things that we ever had to do was to give names to our 2 children, the youngest of them. I tried my best to name our daughter, our youngest child. I wanted to name her Sojourner Jubilee. I lost. Instead, she became Harriet, in the spirit of Harriet, the one who was indeed a part of a bloodline that sustained so many who we find ourselves still respecting who they are in terms of their names and in terms of the things that we are the beneficiaries of because of the way in which they believed that they were in a place and they were a part of something that was significant, important, and that they knew they wanted to be around to encourage. Today, I say to you, as we share in this memorable and most important moment, the one thing I pray that we all will leave here with is a sense that we played our part and we have made a commitment to make sure that there is something in this situation, this place, and this day that will allow us to know that no matter what, we want to be the ones who play our part and make sure we carry out our responsibility to make sure that this community is being sustained in a way that will allow all that's good and all that's right and all that's just and all that's fair and all that represents who we really are will always be a part of this place. And what we do here this day, I pray, will allow all of us to leave here with something that gives us license, insight, and understanding into why it is that we ought to be sure that we sustain the bloodline of North Nashville. If you want the other 21 names, I'll be around for a while.
Good morning, everyone. I want to thank all of you for being here today. It's a very special day. I would say this is the day that the Lord has made, and we should do what? There you go. So this day really marks a renewed era of partnership and a collaboration that goes back decades in terms of the relationship between Nashville General Hospital and Meharry Medical College. I'm Dr. James Hildreth. I'm the proud president and CEO of Meharry, and I'm my chief cheerleader, one of my favorite roles here. I first must thank the leaders on my team who worked so hard with the team at Nashville General to make this possible. They're my provost, Dr. Jeanette Southpaw, the dean of the medical school, Sonia Harris Hayward, our general counsel, Ivanetta Davis Samuels, our vice president for external relations, government relations, Michelle Steele, there in the back, and all of those who played a role in getting us to this day. So nearly 150 years ago, Meharry was established to educate and train brown and black healthcare professionals who were, at the time, refused entry into primarily white institutions in the South. These professionals were trained to go out into underserved communities that these same primarily white institutions refused to treat. Today, we uphold this same mission and promise that we set out to achieve all those years ago. And since the late 1990s, Nashville General has been a foundational partner in allowing us to achieve those goals and that mission. With the signing of this agreement, Meharry and Nashville General have realigned our operational goals, our operational ties, and improved our ability to fulfill our missions and a shared vision, which is to benefit all of those who live in Nashville and Middle Tennessee. I want to thank my new friend and colleague, Dr. Veronica Elders, who's been a joy to work with, who's the interim CEO of Nashville General Hospital, for her leadership and working with urgency and focus to make sure we could reach this agreement, and for giving us guidance in how to achieve the highest potential for our institutions as we work together. Through this realignment with Nashville General, we are thrilled, more than thrilled, that our residents and our medical students, guided by faculty, will continue to receive the highest quality training necessary to complete their education to go out into the world as competent, compassionate, and determined healthcare providers. Our unity is much anticipated, and I would say is needed now more than ever due to the uncertainty created by recent federal policy actions and legislations that, among other changes, will likely result in Medicaid coverage being lost by many who live in Davidson County. All the people of Nashville, all of them, need and deserve access to high-quality health care, and they will get it through Meharry and Nashville General. The signing of this professional service agreement not only cements Meharry and Nashville General's partnership for many years to come, but it solidifies Nashville as a hub for serving all, including the underserved and uninsured, in turning Nashville into the best place it can be by creating a healthcare ecosystem that serves all who live here. And we have an amazing ecosystem for healthcare. It might be the best in the nation, perhaps one of the best in the world. And all of us, every one of us, needs to benefit from that fact. And this partnership will make sure that that is the case. So together, Nashville General and Meharry will be able to provide essential medical services for all residents of the greater Nashville area and respond to urgent patient needs in our community. Together, we will work to provide patient care and act as Nashville's safety net system, expanding the availability of medical services and enhancing support for all residents who live in Davidson County. Together is our path forward, and it begins here and now. And that's a very exciting thing indeed. So, with that, I would like to turn the podium over to my new friend and my great colleague, Dr. Veronica Elders.
Thank you, Dr. Hildreth, and good morning and welcome, everyone. My name is Veronica Elders. I'm the Interim Chief Executive Officer and Chief Nursing Officer of Nashville General Hospital. I can safely speak for myself and the Hospital Authority Board and the Nashville General Hospital staff that we are so pleased to be here today to sign and celebrate this agreement, this pivotal partnership between our two historic organizations. Nashville General is the city's very own hospital, and Dr. Hildreth and I would like to extend a heartfelt thanks to Mayor Freddie O'Connell for all his help and leadership in restoring this partnership between the hospital and the medical college. Thank you, sir. Nashville General Hospital has been a place where for 135 years we have lived out our community's commitment to its own people. We could not do this without the support of the mayor's office and the metro government. Inside that building behind me, we have highly trained staff, nurses, and doctors that deliver compassionate care to all who come through those hospital doors. Our commitment to quality of care is evident as well as when you're considered that we celebrate consecutive A ratings in the Leapfrog group for patient safety. We also offer cutting-edge care through our robotic surgery program and our specialized bladder cancer detection technology. Providing access to innovative, evidence-based care is essential to our mission. I do want to thank a couple of members of our team to help that helped with this agreement, Dr. Kimberly Blackledge, Dr. Deanne Bullock, as well as Christy Lewis, our compliance officer. Thank you. What makes the work inside that hospital so incredibly special? though, is the fact that it does not just stay within the walls of the hospital. We were the first in the city to have a sexual assault nurse program years ago to assist those rape victims in crisis. Nashville General also has a unique medication assistance program that delivers medications to the bedside, provides free medications, and also offers financial assistance, leading to significant improvements in patient outcomes, health literacy, and overall health well-being. As the safety net hospital, Nashville General Hospital is uniquely positioned to address health equity issues and social determinants of health, such as food insecurity, which disproportionately affects our patient population. Because we understand food is medicine, we have a food pharmacy which provides fresh produce and nutritious food to help patients through their chronic conditions. We also support our state, metro government, and NES workers through a health care incentive program. The mission of Nashville General Hospital is to improve the health and wellness of Nashville, and we do that daily with our Meharry partners. We are here today to recognize this new agreement and what it means for both institutions. For Nashville General, it means the most up-to-date and experienced medical teams play a direct role in providing care while also shaping the next generation of Nashville physicians. With Nashville General Hospital and Meharry Medical College standing side by side, we are sending a clear message that we are both dedicated to breaking down the barriers to healthcare access and ensuring that every individual feels seen, heard, and cared for. With the support and vision of Dr. Hildreth and Mayor Freddie O'Connell, we are so eager and confident that this partnership will drive trust, encouragement, and community impact to those we serve and who are often underrepresented. Thank you for joining us today and witnessing this monumental moment. Your presence here shows a shared commitment to our city and its people, a community we all call home. It's now my honor, on behalf of Nashville General Hospital and Meharry Medical College, to again thank and welcome Mayor Freddie O'Connell.
Well, thank you, Reverend Sanders, Dr. Hildreth, Dr. Elders. Reverend Sanders, you have caused me abruptly to rewrite my remarks on that theme. I do want to call some names because it matters. This is an esteemed gathering, and I know we've got several people on our team in the mayor's office here who have helped make this possible. We also know that this partnership is emblematic of a spirit of shared interest and shared ownership in this project, and so I want to recognize and say thank you to Senator Charlene Oliver for being here, Representative Harold Love for being here, Mayor Purcell, about whom I've learned so much of the history, from whom I've learned so much of that history of these two important institutions through the years. Councilmember Delicia Porterfield is here, who chaired our Budget and Finance Committee and made sure we could continue a round of investments. Councilmember Erin Evans, and I don't know if she has arrived yet, but I know Councilmember Quante Toombs, who has chaired our minority caucus of the Metro Council for years, has been a key partner in making sure we could arrive at this moment of success and look beyond it. And then I would also like to invite, we have so many of our Nashville General Hospital board members here. Would you all please at least raise your hands so we can recognize all of you? Thank you. This board has been a group of leaders who have had to work through some difficult moments in order to cultivate this restored partnership today. And I think, I know that I'm not the only person here who is grateful for their shared leadership today. But as Dr. Hildreth and Dr. Elders have both noted, Meharry Medical College and Nashville General Hospital both have long legacies in our community. Nashville General Hospital dates back to 1890, when what was then known as the City Hospital opened on Hermitage Avenue. Now, over the years, the name may have changed, but this is still the city's hospital with that singular mission, providing access to affordable, high-quality health care for all. That mission and Nashville General's legacy move forward today as we celebrate a new agreement with an essential partner. Meharry Medical College, established in 1876 to support better access to education and health care for Black and brown communities, is now the nation's largest private, independent, historically Black academic health sciences center. And we are a Meharry family. Arriving this morning, I was called back to more than a decade ago where a white coat ceremony in this very building enabled Dr. Whitney Boone to continue to pursue her career in medicine. She is now a Meharry-trained pediatric neurologist, and I'm also so fortunate that for the past 20 years I have been mentored, tutored, and welcomed into a profound proximity to the bloodline of North Nashville. I saw Tanae Franklin here, who about 20 years ago welcomed me into the Nashville branch of the NAACP as we had just moved on moved into a neighborhood right near Jefferson Street because Meharry had enrolled Whitney Boone. And so we settled in Salem Town just about 20 years ago, and those early conversations in the NAACP helped anchor me here. Sharon Hurt, then both of us, just me as an emerging neighborhood leader and her as an established leader in the business community, welcomed me into the fabric of Jump. Matthew Walker, just down the street, welcomed me. Fisk University welcomed me. Nate at Woodcuts welcomed me. And so I have spent so many years coming to understand the importance of that bloodline, and that bloodline tracing through to this moment today with so many of the people that I've recognized who have been key to my own scholarship of the importance of that bloodline. Showing up today matters so much. The fact that you all are all gathered here today, I can't overstate my gratitude to the partners that are making today possible. We are honoring these shared histories today and taking a major step forward in the future of public health care delivery in Nashville with this relationship as its foundation. And I have maintained since taking office that a brighter future begins with this partnership. And today, the strongest symbol possible of that is the execution of a successful professional services agreement between these two historic healthcare institutions. And that is what we are here to celebrate. So I'm here to congratulate and thank the leadership and boards of both Nashville General Hospital and Meharry Medical College as we sign this agreement. I want to thank our Metro Department of Law for their assistance in making this a reality. This is a multi-year professional services agreement between Nashville General Hospital and Meharry Medical College, and it does realign those operational ties. It solidifies a critical relationship through which Meharry residents complete their training at Nashville General, and the hospital benefits from nationally recognized expertise in expanding healthcare access. The relationship began formally back in 1998, and the new PSA, after years of it being lapsed, extend that original agreement into a bright future. And our broader focus here, as always, is to improve quality of life and affordability for our residents. One of our guiding principles has been to provide stability in uncertain times. And as you heard Dr. Hildreth allude to, it is challenging when the federal government retreats from healthcare commitments and other core responsibilities. But locally, we are strengthening that commitment. With thanks to colleagues on the Metro Council, we're investing $67.5 million from this year's operating budget to deliver health and wellness programs like Nashville Strong Babies through our Metro Public Health Department, additional HIV and STI prevention and treatment, ongoing vaccination access, mobile health programs, mental health supports, and a 2% increase for Nashville General Hospital's operations. But what today represents at this site of healthcare research, training, expertise, and delivery, what today represents is a new day for healthcare access. Whatever possible future you can imagine, all of them begin right here with the strengthened relationship between Nashville General and Meharry Medical College at its core. So thank you all for being here today. Thank you again to Nashville General and Meharry and their leadership for this critical work and this great step forward. And now I would like to welcome Dr. Elders and Dr. Hildreth and members from leadership at both institutions to join us as we sign this historic agreement. Congratulations.
Thank you. I think our board, I'd like to recognize.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.